du sangano dzvenera Mwari pamusoro iyi. October, we were celebrating breast cancer, or we're commemorating Breast Cancer Month. And November, tinotaura nezve men's health. Saka pamusoro health committee, makaona zvakakodzera kuti timbokurukura pamusoro pechinhu chinonzi cancer. On Tuesday, as a family, we buried my sister-in-law, a very young, vibrant, and very energetic young lady, 36-year-old, who had battled cancer for 10 years. And on Sunday, cancer won the battle. But it made me realize one thing. There are times when we pray for grace and say, God, please heal. And tinozvitenda tinobva tafara kuti mwoyo wedu warapwa. But there are also times when we pray for grace for God to make somebody rest in peace. And cancer somehow is doing that to us. Because when you have somebody suffering in the home, it takes a toll. And at times it can be very bad. Tinoziva pane mamwe zvimwe zvirwere zvatinoziva traditionally, zvimwe zvakatotumidzwa mazita emadunhurirwa, but they are not as bad as cancer. So apparently nutrition, or good nutrition, plays a crucial role in decreasing cancer risk, in supporting cancer treatment and recovery. It is not a silver bullet yekuti good nutrition then munhu haachaiti cancer kana kuti. There are so many other things zvinogona kukonzera kuti munhu aite cancer. I think we had a discussion with Dr. Rumbi the other day when she was explaining cancer. So there are so many factors, but good nutrition inokwanisa kubatsiridza to alleviate or to reduce some of the risk factors. So some nutrition behavior which decreases cancer risk include maintaining a healthy weight, also exercising regularly, kune vari kuyamwisa breastfeeding for more than 15 months, iyo iri related to breast cancer. Zvese izvozvo zvinoonekwa kuti zvinodecrease cancer risk. And there are some behaviors which increase cancer risk. I'll talk about just the nutrition related ones. A sedentary lifestyle. Sedentary means tinongobuka, tinopinda mudzimota dzedu, taenda kwatiri kuenda, even if it's to the shops, angori a kilometer away, toenda, takagara, toswera, takagara, we are not doing any form of exercise anyhow. That sedentary lifestyle puts us at risk. Inotanga yatisa at risk of zvinhu zvakaita se overweight or obesity. Then yozotisa at risk of other illnesses, including cancer. Things like smoking, things like alcoholic beverages, all of these increase our risk of cancer. So cancer treatments are usually designed to kill cancer cells. And amongst the treatments, atinoziva or are common particularly, pane radiotherapy ne chemotherapy. But these treatments, kune vanachiremba, vanotaura kuti these treatments at times also then damage healthy cells. So now, what then happens is we are then trying to say, kana ma healthy cells are damaged kwa parikuitwa treatment here, how do we restore? How do we restore those cells? Because a damaged healthy cell can lead to ma side effects akawanda. For example, appetite loss, ma changes in sense of taste, constipation, diarrhea, any of those side effects anobata munhu kana aine cancer. So it's not everyone anenge aine ma eating problems when they have cancer, and there is no way to actually know kuti inini chaita ma eating problems akati or achagara kwenguva yakati. There is no way to know, but it really depends at times at the cancer that you have, and where it is in your body, what kind of treatment you are taking, and how long that treatment lasts. So, my benefits of good nutrition during cancer treatment, first of all, we try as much as possible to maintain strength and energy. Eating a balanced diet help you to get strong. I'm going to talk about a balanced diet. Sekuziya kwatinongoita madzidzisirwo atakaita ku-home economics around grade 3 or so. I'll talk about it. And then good nutrition also supports immune function. It also helps us manage the side effects. So, what are the foods that should be included when somebody has got cancer? These are useful when reducing the risk or managing the side effects of cancer. And generally, they are just good foods, or they are good feeding behaviors that we should exercise, cancer or not. These include plant-based foods. So, plant-based proteins in particular. Because remember, treatment sometimes it's targeted at killing the bad cells, but then it can get to kill the good cells as well. And trukuda protein to restore those cells. Antoti protein is for bodybuilding. So you need that protein to restore the cells. But plant-based proteins are good. They are easier to digest. And also they contain fiber. Needwa. For example, kana munazo any constipation or the like. So eating plenty of plant proteins, for example, kuvamu beans, kuvamu nuts, kuvamu seeds, these are excellent sources of plant proteins. And they give us energy as well. And they rebuild my tissues which have been harmed by the cancer treatment. My fats, which are healthy, are also good. They restore energy because fat paino benwa inotipa energy, but they are good fats that one should concentrate on. And these also come from plants like avocados, olive oil, nuts, as well as fish oil. It gives us good fats. But say, for example, tine nyama, and you want to choose, kuti sakandoita say in terms of fat, you should eat zvinhu lean cuts of meat. For example, patinotenga beef paye, pane inotooneka ine visible fat kuti ichi chewhite ichi. And ndochiziva kuti ndochinonaka chacho, ndochinoitisa kuti, I don't know, zvinyatsoningirina. But it's important then to remove that visible fat, to have pork trimmed of all the fat, to have poultry without the skin. All those, you're choosing lean, or you're maximizing on the protein that is good and minimizing on some fats, and not going to my problems as well. Choose low-fat milk products. Mazwano tikapinda grocery shops edu, mazara zvinu. I'm going to talk about reading food labels because it's very important as well. Mazara zvinu, that give us options. So there are low-fat milk products, which include pane low-fat or non-fat yogurts, but skim milk. All those are low in fat and they are good. Because fat ya mukaka comes from an animal source. And atiskuda kuti inyanyo want mumuiri. So what you want is the low fat, unless if you get milk yakabva from soy, kana uti yakabva from chibage or something like that. So minimize on the fat, for example, butter, mayonnaise, desserts. Takupinda period iyo yekuti tenge tichidya zvinhu izvozvo zvinonaka, anditi in quotes. But let's be mindful as we fry food, as we add butter and mayonnaise nezvakadaro. Let's be mindful to what kind of fat are we using. And also, it's important to cook with some low-fat methods. For example, boiling, steaming, grilling, roasting. So, change in cooking behavior, actually, it will help the person who is suffering cancer within your household, and it also works to help yourself as well, because makutojika very healthy mess. And then, whole grains are very good as well, as an addition to your diet. For example, foods like whole wheat, brown bread versus white, brown, if it's mealy, chisina kunyanyo shurwa, chia is better than chakashuri. All these, they help with the fiber. You also need, if somebody, for example, has a side effect, constipation, But then again, when we are talking about somebody with cancer, they could be having diarrhea. So the reverse would be true with that person now. They will need to lower the foods with a lot of fiber. So it's important to always consult when there is something that is manifesting. Kuti saka apa toita say, whilst we know generally kuti high fiber foods are good, in a particular instance, yekuti mwe munhu ane diarrhea, that they won't be very good because they will still help in terms of bowel movement. It's true kuda kuti munhu aretain chikafu chaanga achidya. Eating a variety of fruits and vegetables is also good. The general rule is that a person should eat at least 5 fruits or vegetables a day, at least. So you have to count wega kuti kubva paunomuka muzuva. Yes, at least 5. So this is how it works. It doesn't mean kuti ndikunotsvaga ma-apple angu ma-pears zvakati kuti zviite 5 in a day kana kuti zviite 5 ndizvidye zvese ka1. You can actually be adding a lot of vegetables in your food. Pekutanga makuseni, let's say wadya breakfast yako and then you have put beans in there. You have already put a portion of vegetables or fruits in your diet. Saka watodya ka1. You can even decide kuti zai rangu ndoribika with a little bit of veggies in there. You are already also putting in a portion ipapo. Anditi. Saka tatotanga makuseni, maskati unogona kuti ka apple and a banana or something like that. In between, porkuita snack time. Be mindful of the times that we snack. What is it that you are snacking on? It's important to snack on something that is healthy. Is it a fruit? Is it a vegetable? You can snack on a packet of carrots. It's allowed. You can snack on 2 bananas. It's still healthy because you are adding on to the between 5 and 7 fruits and vegetables that you should have in a day. Saka, there are a lot of things that we can do in between, including also having nuts, having zvakawanda zvatinokwanisa kuita, and you realize that 5 to 7 is really attainable, especially when you make a decision to make your diet plant-based. Foods to avoid. It's important to avoid highly processed foods. These, they cause inflammation or they increase the risk of inflammation, and generally they are less nutritious. So it's important to go easy on things like fat, sugar, and salt. Whatever you do, be mindful. Fat, sugar, salt. Reduce those. So it's important to know the amount of sugar that is in a particular food. Section kwedu takamboita exercise. Because most of us professed kuti ina handishanwe sugar mti. Anditi. So we were happy and we said we don't take sugar anymore. But then what happened is we analyzed the amount of food or the foods that we eat. Tinonwa ma juice, tinonwa ma sodas, tinonwa whatever food. Then we realized kuti in a particular juice, one of my favorite, there is ukaverenga ma ingredients aripo, unaona uti per 100 mils of a juice, mune 8 grams of sugar. Saka kana mati mune 8 grams of sugar per 100 mils, in everyday ndichinwa 500 mils, zimwenguwa a liter of that. It means pandonwa 500 mils, ndrukunwa 40 grams of sugar. Kuneva no beka, kuneva no ita shekuningirinda, my calculations, 40 grams of sugar is equal to 8 teaspoons. So, andinwe sugar mti, I drink 8 teaspoons of sugar in a day. Sometimes ndikazonwariri 2 liter, how much have I drank? So we need to be mindful when we are talking about sugar, when we are talking about salt. Just be mindful and read your food labels. I'll let you know how to read food labels very soon. Go easy on alcohol, on smoked or pickled foods. And also, go easy on char-grilled meat. Coach. Sorry, Yenyuma under 40. Why do we say that? Science have proven that panosangana nyama, ne smoke, producer the product, iri char-grilled, There are some chemical compounds activate kwa munyama yedu, which when consumed, anogona activate zvagara zvirimo mumwiri medu zvinokonzera cancer. So it's more like a radiation therapy. Remember, for cancer as well, we say we should reduce my x-rays, we should reduce my radiation. Kare takatonzi regerai zvekuisa mafoni umu because of that negreen. Ndizvo zvimwe chezvo when we eat koch. Zvinoitika. So go easy on it. It's allowed, but in moderation. And then we should eat less sugar, less salt as well. We should avoid raw or uncooked foods, particularly for a cancer patient. We know we like raw fish, we like sushi, abeno shiripo, shakasiyana. Those should be very avoided because there's a likelihood of some foodborne diseases in those foods as well. We should avoid unwashed foods and fruits and vegetables, as well as highly processed foods. So what is the practicality of it? Tozviita say in practice. When somebody has got cancer, they should eat when they have the biggest appetite. Because tinotoziva kuti my chances ekuti haasi kunyanyofarira kudya akawanda. But paanoti ndakuda kudya ipapo, maximize on that opportunity to an extent yekuti ari kudya zviri healthy for them. You know, it's only a small window period where they should have something very healthy. And usually this is in the morning, paanenge vachangomuka. Drink plenty of liquids. Liquid, in particularly clear liquids, like your water, the best liquid that ever existed. Why? Because inobatsira nutrients kuti flow in all body parts. And then take special care of food. This is very practical now in terms of food hygiene. How are we handling our food? Kana turikubikira papi, turikubika sei. Food hygiene is key because she not minimize my chances ekuita my infections when we have consumed that food. Chikafu chiri fana unge chiri hot, ndachidyiwe chiri hot. And chinofana unge chiri cold, ndachidyiwe chiri cold. Leftovers are not really recommended. But when you have to have leftovers, they should be kept very frozen or whatever, refrigerated. And anofanirwa kudyiwa only at one heating. Not kuti amboitwa nhasi, mangwana tobva tati aiwa ndo yatakuda futi toiita futi. You are activating, deactivating bacteria inenge iri mufood and putting yourself at risk. It's important to wash our hands. This could be like common knowledge. But kangani patinotaura kuti zvokugeza maoko zvazvimwe zvinouraya chaizvo tozviziva. Kugeza maoko kwakakosha. Wash your hands, wash the knives, wash the countertops before and after preparing food. It's important to also separate my utensils. For example, cutting board renyama should be different from cutting board rema veggies. It's important to separate that as well, to avoid that cross-contamination inoitika pachikafu. And then, it's important as well to thaw, kana ku unfreeze our meat, our chicken, our fish, thaw it in the refrigerator, not kuisa pa open, pachena. Do not leave it out standing. Because again, peiri kuita thaw, inogona ku batana nemamwe microorganisms arimo green. So thaw it within a refrigerator. Or, kana zvanonokesa, you can put it in a microwave to defrost. We have talked about raw fish. This should not be consumed. And in particular, when somebody has got cancer, make sure that milk products, say honey, all those are pasteurized. And then do not use foods or drinks that are past their freshness date. This is very key. Might look like common knowledge or common sense, but I'll tell you, a lot of times munhu anozorealiza kuti atenga chinhu chakaexpire atokumba. I think I might as well come to the reading food labels. What I always say is, do you know what? When you are buying food, you should take time to read your label. mumwe anotenga chikafu atomboziva kuti chii, anongoziva kuti cereal, inonzi iyi cereal yacho. Take time to read your food labels. You are the one who is going to eat that food. You are the one who is going to pay for that food. So no one is rushing you. Apana storekeeper anoti kasika ikubuda muno. Nokuti muri kuverenga ma food labels. Why do we stress on issue a food label? It's for you to know the name of the food that you are eating. Per food label, pane saving suggestion. Know the saving suggestion yakataurwa per food label. I'll take an example of cereal, which is easy. Cereal kakawanda kachi, we just take the bowl, toto tanga ku pour into the bowl. But every cereal has got a saving suggestion. You're not gonna kukuza what 8 spoons only, or 2 cups, or 1 cup. Shino bowl sharine 3 cups. Is that the saving suggestion that was required? No. And it can then lead to other things like overweight, obesity, and any other thing. You see, that's why there's an intention, a saving suggestion, pachikafu chedu chese. Do iri recommended, inoonekwa kunzi kuti uone manutrients aunonida iwewe as an adult, cannot as mwana, ukadya portion yakadai also in a day. This is sufficient for you. Also, you take note of the ingredients in that food. Ingredient listing yakanaka, because ukatarisa pa ingredients yechikafu, they are ordered. Mutemo wechikafu unotaura kuti order on the list of ingredients is from the highest to the lowest. Saka pa the first 3 ingredients, the first ingredient ukaona yakatonzi sugar, it means you are eating something chiri very high in sugar. So take note of the order of the ingredients aripo pa chikafu chako. Nutritional information is also very key. Why is it key? Inokurakidza kuti per 100 grams of this chikafu, how much of protein am I getting? How much of sugar am I getting? How much of whatever am I getting? Also read the best before date. It helps you know kuti chikafu changu chiri fresh here or hachisi fresh. So you should take note that labels animal standards. And when chikafu chikazoiswa mu outlet, chato follow ama standards yao. Whether it's the food law, iripo internationally, or the Food and Food Standards Act, irimo mu Zimbabwe. And zvese zvandataura zviri mandated kuti zvinge zviripo pa label. So take note of your label. No one is rushing you. What else is important? It's important for you not to eat, especially when someone has got cancer. Don't eat foods at buffets, foods in a salad bar. Those are not, because they've been exposed for a long time. Aripo, pachena. So they are not quite healthy, or they won't be healthy, particularly in this case. Any foods that are showing any signs of mold. Mumwe munhu anototi akaona mold, wototi ndongobvisa ipapa chete. Ndozodya hangu the rest. We should not do that. A moldy food is a bad food. And mazuano, you are even allowed to go and return it. Uchitopuwa, something that is fresh. It is recommended for a cancer patient to eat small, frequent meals. For example, 5 to 6 small meals each day instead of 3 large meals. Because those can be very heavy on a person and they make them feel too full. So, small, frequent meals. As a caregiver, maybe I will see une cancer, but as a caregiver, have that heart, yekuti munhu anoda chikafu, but more often than a healthier person. And then we've talked about healthy snacks, such as my fruit bars, my nut bars, my dried fruits, and the like. And then liquids should be drunk throughout the day. You should only avoid liquid just before a meal. If you have to, you drink it 30 minutes before a meal. Because my liquids are a tendency, and they become, you don't eat as much as possible. Liquid in itself, water, doesn't have many nutrients. Chatrukuda maximize on chikafu chinema nutrients. And also you can rest after meals. But the resting yacho should not be lying down. You rest when you're sitting up so that chikafu chinonyatso end. Kwachinofanirwa kuend. Exercise is very key. It also enhances your appetite. So you find that all these good behaviors. They work whether you've got cancer or not. But what are the take-home messages now? The first one is minimize on the sugar, the fat, and the salt. Let's minimize. There are some foods that we don't expect to have, for example, salt, but no contain salt. Because each patino chijika chirimukanwa, it's sweet, and we don't think it contains any salt. But if you read your label, shakanaka, unonot chile salt. So it's important then to read food labels. Food safety and food hygiene is very key. The papi pachabikirwa, the papi ma utensils ashashandiswa, chikafu chacho chiri kumbogeswa here. You should always consult the healthcare practitioner in terms of managing my side effects or whatever problem that has arisen. Always consult. And if you are a caregiver, do not get upset or surprised. The patient akatanga kuti test yangu yachinja ndichada ichi kana kuti akuda zvimwe zvinhu zvisiri izvo zvaakadya nezuro. Be patient with them because my side effects anogona kuuya through my treatments anenge aripo. It's very normal that a cancer patient feels depressed, anxious, afraid, or angry, alone. It's very normal. And this can alter my eating patterns out. So it's very, very key to be patient. So a lady called Anne Wigmore once said, the food you eat can either be the safest and most powerful form of medicine or the slowest form of poison. We should be watchful when we eat. And this applies to everyone, a patient or one who is not a patient. 1 Corinthians 10 verse 31, you know that. So, whether you eat or drink or whatever it is that you do it all to the glory of God. Marana sotibatsira, as we take care of cancer patients, as we also take care of our bodies. In our church, we've got stewardship and committee. One of the things that we should be good stewards to is our bodies. Be a good steward of it. Don't use it like a trash can. Uchingoti chero chese ngachipinde imomo. Starababa rimwana komana rimwana.